Hey everybody on Jessica Cameron's forum, Wannabe Beauty Guru. This is Eve and I am 67 years young. And I made a post the other day after doing a treatment on my neck that kind of made everybody go a little crazy because I think they got a little bit of the information I posted wrong. Forgive me, I had just gotten out of bed. I'd removed my CO patches and voila, I such incredible results, promising results, not miraculous results, however, because the before photo, I forgot to mention, was actually taken 3 months previously. And I don't know where to look because I'm trying to do this and give you guys close-ups, of my neck and my results. Forgive the Casper thing I got going on here because as you can see, this little Casper, I've got hold on, I'm going to have to reach out of the frame every now and then to grab the products that I'm explaining today. So I had to use, this is my Mineral SPF 60 by Neutrogena, and it makes you look like Casper. It's very, very white, very glowy. But, hey, I wear SPF now. I'm 67 years old, like I said previously, and for 66 years, I did not use SPF 60. Hence, the reason my neck fell like it did, well, I noticed my neck fell like it did about 3 months ago, around 3 months ago. So I did post on my neck a very radical picture of my neck because that's my issue. That's why I joined the forum. That's how I found Jessica, looking at things to what I can do to fix this neck and it so far what I'm doing's helped. But now there's going to be a lot of things I explained to you today that I have and they're not in the frame. So hold on. I got to get these items. Forgive me. I thought I prepared everything. I had forgotten a couple items. Hold on. I am going to edit this, okay? And I don't know where to look. Should I be looking over there? I don't know. Okay, my God. To tell you what we have to spend for beauty is freaking insane. Okay, for those of you that are interested in my lips, I don't have the Russian lip technique. However, people have told me that I need to dissolve my lips in order to redo my lips to have the Russian technique. And I'm saying I beg to differ with you. I've been certified in the hyaluron pen. I did do injections in my lips, 4 or 5 years ago. A micro droplet technique, very similar to the Russian technique. That's not what they called it then. So my lips kind of want to go up that way. Someone mentioned that I do have filler migration. Yes, I do. It's one of the reasons I started going to the Russian technique because the girls that were injecting my lips had my lips looking like freaking sausages. Let me show you like this. They were freaking sausages. And I'm like, no. They're not artists. I am. I'm a doll artist. Former doll artist, retired now. Too much information, guys. I have to get this all in. So I started, just learned the hyaluron pen so that I could start doing my own injections, basically. Little tiny bit, maybe not. I wouldn't even use a mil in my top or bottom lip at any given time. Never. Just a little like think, and every now and then go up here, go way up here. Just the filter and vermilion border, just tink, just tiny, just 0.01. I never do anything hard, and that's another video I'm going to do. It's about a Dr. Van Eyck, John Van Eyck, I think his name is John Van Eyck, who has taught me much about what's called the Fern technique. So Google Van Eyck. Oh no, you don't know how to spell that. Just Fern technique, okay? The Fern technique. That once you learn something about the Fern technique, you'll realize that your superficial dermis is actually stronger than the mid-dermal layers, where when they do the injections, for the nasolabials and things like that, they're going way too deep to actually feel. I don't know how to explain it, but the Fern technique is sort of like cross-hatching, very superficially. Amazing. You guys got to learn a lot of stuff. We all do. We all do. So anyway, and this is the product I use now, Higher Rev Classic, for my hyaluron pen. I don't have my hyaluron pen out here. If anyone wants to see that, it's made by Lux Lips Lab. It's called the Ninja hyaluron pen. And another thing, I'm new on this forum, but I'm not new to YouTube. I've done my hyaluron pen review on YouTube, so I will link my YouTube channel. Please subscribe if you guys can. I'm not here to compete with anybody. I'm just here to share. Everybody went nuts. They're like, what did you do? What did you do to get the results for your neck? So I'm trying to explain it, but it takes a lot. It's taking a lot. As you can see, it takes a lot. So, okay, what did I do? Well, first, I got a mini haifu. Okay, well, no. First things first. Okay, we're going to do it. 3 months ago, when I realized my neck was destroyed and other things were happening, I noticed the jowls were dropping. I'm sorry about my bruises. Jowls were dropping. So I said, oh my God, I need to do something. The skincare stuff that I'm using, which was pretty much nothing, and now I notice I need to turn notifications off when I'm doing videos. It's so distracting. So I switched to medical grade skincare around 3 months ago. Could be in February, March, April, May. Right, 3 months ago. Okay. So what I started with is Truth Treatment Systems. Ben Fuchs. Dr. Ben Fuchs. Truth Treatment Systems. Especially his 5% gel with retinol, but it's better than and less irritating than medical grade Retin-A, although I have that too, and I do use it, and I also use Adaptolin, and then his transdermal C serum, which is I think it's around 70%, 50 to 70% vitamin C, but it's a stabilized form of vitamin C, so it's not as irritating as L-ascorbic acid. But if you like L-ascorbic acid, use that. So I've got both the serum, the transdermal C serum, and the transdermal C balm, the biomimetic mineral mist. I'll have links to everything, guys. And then I also, once a week, I started doing the Ordinary's BHA AHA peel. This is the one that everybody does on TikTok. Looks like blood. Look at that, vampire blood. This is incredible. When I cleanse my face and do everything, and then use this and wipe it off. Oh my God! You talk about glass skin. But now I still need a lot of work. My eyes, but also I have very heavy brows. So my brows had fallen. So yeah, that's another story. We'll get to that and we'll move along. And then of course, everybody, I make my own. But I just buy hyaluronic acid powder, a good grade, 100% pure or something. And I mix my own hyaluronic acid powder. No matter what skincare you use, drive that stuff in and just layer this many, multiple times, and you'll do good. And then, although the patches, I also use these patches. This one was a gift. This is the OIA patches. However, I got these as a gift. I think these patches, as far as quality, suck. But I own them, and I use them, and because I have them. But I found the better patches. And the better patches I found on Amazon, and they're called Blue. Unfortunately, I don't have a new pack. You get the neck, the chest. You get all of the patches that you get with Oya, but however, it's less than $20, including the shipping, and they last longer. And to help hold them in place, I use Mebitac tape, because sometimes they do want to lift. I use the one on the neck. I use the one on my chest. And please forgive this top. It's filthy, because this is the top I wear when I do my treatments at night. So, yeah, and it's filthy. But I can't put on clean clothes to do this review for you gals, because I just can't. So, another thing, when I did the treatment on my neck, here is the product I used. It's called Dr. Lipo Plus. See that little plus symbol? And then that's a V. Dr. Lipo Plus V, red box. Got it on Ace Cosm, okay? And use Jessica 10. whenever you buy anything at Vianacare or Ace Cosm or any of the other vendors that only Jessica Cameron recommends, please use Jessica 10 for 10% off your order at checkout. Don't be stupid. Use that. And order a lot. The more you order, because I forget what their shipping is. I think Vianacare's shipping is like always $30. I think. I don't know. But we're talking about Ace Cosm. So I used almost an entire vial. As you can see, there's a tiny, can you guys see that? Tiny, tiny, tiny little bit. I used 4 mil in my face. People were saying, how did you do this? Did you map? Okay. But yes, I did map, but I did a loose mapping. What I did was I took a pen like this, and as you can see, here's my problems. Jowl area. Okay, guys. See, when I say loose, I may be an artist, but this isn't rocket science stuff, and I can't see in this tiny little monitor. And right here under my neck, where you see this, where my fat pad was. Now, all of you know that there's areas that you kind of have to avoid when you do this. You got pretty much this bone area, all along this bone area, just a hair above and a couple centimeters and below. You do not want to inject into a nerve. So you also got to pay attention to this area. Okay? So stay out of certain areas, and you will be, now I've ruined my freaking makeup. This is my makeup for the day, girls. So anyway, okay. So I used insulin syringes, and that's another thing. Before you do any technique where you're doing injections, I don't care if it's lips, I don't care if it's mesotherapy, I don't care if it's microneedling, I don't care what it is. You are going to want to sanitize everything. And God, I'm so distracted. I'm trying to get all this information in. This is going to look crazy. It's going to sound crazy. I knew before I did this, there's absolutely no way I'm going to do this in perfect order. No way. No way. But I promised to do it, so I'm doing it. So, yes, you do the injections. You make sure everything's sanitized, sterile. You wear gloves. And then I grabbed the fat. As you can see, I still have maybe not so much fat because I don't really have any fat now. Here I do. I may have to hit this again. But you pinch the fat as much as you can. Now, I'm not going to sit and stretch my skin, guys. Undo all this good work I did. And then you drive that needle. On the back of this box is the instructions on how you're supposed to do this. How many centimeters apart your your injections need to be, and how deep. I used 8 millimeter, 30 gauge insulin needles, and I drove those suckers to 5 millimeters deep. Okay, and you pinch each place you inject. You make sure you grab that fat between those fingers, and then you take that needle. And like I said, I loosely mapped because I know where my fat is, and I was grabbing it, and then I would inject. I would hold it real tight, like not what I'm doing now, and inject, and then you inject and you inject and you inject. And I used a syringe on this jowl, and 2 syringes in this fat pad. And then I put this thing on, which is dastardly. Please be careful. But now bear in mind now, oh my God, I got something on already. Whatever. I look like a grunge anyway. But remember, I put on my CO patches too. Okay? I put on, or not CO, my Blue patches from Amazon, and there will be a link. And then you got to put this sucker on. And be careful. This has industrial grade freaking, what do you call this stuff? Velcro, okay? So if you put this on wrong and you get this caught in your hair in any way, shape, or form, you will be bald, okay? You will be bald. That's all I can say. So this went on like this, but I had my patches on underneath. See, I got my cap on. And then I slept with this on. So what you guys saw the morning after, okay, see, look how lovely. And I try to get this. So it's like that. Okay, see? Like that. Excellent. And then I had my neck patch on. And this thing is a compression band. And I think you get doctors that differ. I guess when they use Kybella or something, they say not to use these. I say use them. If you use Kybella, I don't care what I use. I'm going to use this because, you can see, this is going to help with the aching. It's gonna help hold things in place. And then here's another item I used prior to using the Dr. Lipo V, because I got the Dr. Lipo V, I think either a day or a couple of days after I joined the forum, and people were telling me what to do to help with my neck. This is a mini HIFU all therapy machine. There's radio frequency in the head, and it's also got the ultrasound that actually, puts heat into the deeper SMAS layer of the skin. SMAS meaning the muscle. You're going clear down to the muscle, okay, which is the layer you want to. And it kills fat also, or destroys or blasts fat. Like I said, I'm not a doctor. I'm not a nurse. I'm not a professional in any way, shape, or form. I'm not licensed to do this to anyone else, nor would I do this to anyone else. All I am is a DIYer like the rest of you that just wants to help anti-age more gracefully and take good care of our skin. And, a lot of people think I'm crazy. And to some degree I am. I do mess up because, like I said, look at all the bruising. Probably if I was a better injector, that wouldn't happen, okay? But I am an injector, and I do it. I'm going to do it. I'm going to continue to do it. And then a lot of people that saw, because where I lifted this up and took pictures the next morning, I still had my patches on. I'm going to say the word CO or Oya. That's the brand name. That's not the brand I was using. And then I use a tape. And it's called Mepitac tape. And a little piece of it, because when I took the picture of my neck, I pulled this up, and they saw the edge, which is kind of like a white edge on it. They were going, what's this string on your neck? What's this string on your neck? I'm like, it's not a string. It's my Mepitac tape. I was excited, girls. I was happy. My neck has really come a long, long way. And I actually attribute it mostly, no, my nose is running. Oh, I got to get this thing off. Mostly to this, and definitely this. But now if you see, if I stand back, turn my head at certain angles, you're going to see loose skin. And Jessica said, and the manufacturers claim with the Dr. Lipo, that this will tighten too. And that the HIFU machine, which I did a little over a month ago, it's supposed to take 4 to 6 months before you see the full tightening effects. And I did my full face with it. I was doing it, upper face, the whole face, full face and neck. Really expensive procedure if you pay to get it. But if you look, I'm going to show you, girls. And see, I still have platysmus bands. Going to have to hit those with Botox or something. But I got a lot of firming and tightening of my skin to do. Everybody's saying get a proper facelift. Well, that's easy for people who have the money to do a proper facelift to do. But not me, because I do not have the money to do a proper facelift. So that's not going to come anytime soon. And I honestly believe that with the products and tools that I have on hand now, that I can achieve. I'm never going to look 22 again, right? None of us are. We're going to be realistic, but some of you, I've seen some skin out there that 22-year-olds wish they had. So you guys are really, whipping this out and getting extremely fabulous results. I'm looking for something I might have missed. What did I miss? No, Mepitac tape. Oh yeah, I do have a Dr. A7 microneedling pen. I hate to microneedle. However, sometimes I do. It's just, I just feel like, there's other techniques that would probably be less damaging and running the less risk of infection and what have you. Because anytime you're opening the skin, you run risk of infection. I would rather do, and I haven't received it yet. I ordered from Viana Care a meso It's the AMI capture. What is it called? AMI capture time mesotherapy with the crystal 5-point needle and syringe. I'm going to do that because it is breaking the skin, but it didn't look to me, because you're doing injections and they're like 1 millimeter, I think, deep. You guys correct me if I'm wrong. And that I've seen people do that, and that, why do anything else? Seems doable. Seems doable, and it definitely seems like that would be better than microneedling. And then I also have a what the heck is it called? It's a microdermabrasion. I have a little home system microdermabrasion. Not crazy about that thing either. It makes me feel like I have a sunburn. Certain things I just don't feel like doing all the time. They're probably helpful. People are saying do talks. People are saying do threads. Those are, I don't know. I'm not crazy about any of those ideas. But I'm not saying I'm ruling them out either. Talks is so cheap. I may just go to my, triple board certified plastic surgeon and have him, do platysmus bands and around here where I'm getting, just whatever. And the 11s when they form again, and that's a cancer scar, kids. So can't do anything about the cancer scar. It's stuck. I can't do nothing about it. So I'm looking now. What did I forget? Because the most important things I did was the HIFU oil therapy, the medical grade skincare, the SPF 60, the doctor lipo, and the silicone patches, the BHA, AHA pills, but specifically you've got to be using anti-aging skin journey. And thank all of you very, very much for sharing your wisdom, your knowledge, and being cray-cray like the rest of us and doing the same. And yeah, that's about it. Bye.